at least for now. I was also, up to this year, I'm on sabbatical right now, up to this year I was in Laurie's position, I was the coordinator for the Master of Arts Island Studies program and the chair of the executive committee at the Institute of Island Studies here. So I've enjoyed this sort of chapter in my life of in island studies, and although I wasn't born on an island, I'm as they say in the Maritimes, I'm a come from away, or a CAF. So my job is to actually start the show out at the 30,000 foot level. So I've got a few slides here that I'll show and put up here. Hold on a second. Here we go. Oops. So, and I just a bit of a plug here. I have a textbook coming out in mid-October, an undergrad textbook, The Introduction to Island Studies, that you might want to keep an eye on. You might hear more about as well. So I guess I just wanted to start this by saying at that 30,000 foot level that if we start looking at the topic of islands and public health or epidemiology, this is not the first time that islands have taken a focus. And those of you on the line probably know some of the work of these individuals better than I do. You have to look first to the work by Andrew Cliff, Peter Haggett, and some of their colleagues as well, for the work they did in the late 1970s into the 1980s as well, island epidemics and so on. And so if you start looking at that work, you realize that islands have been special places for those people that are very interested in public health, tracking illnesses, epidemiology, and so on for a number of years. I have a couple of slides up here. The one up in the top corner is actually derived from a Cliff and Haggett book on island epidemics. And it looks, I won't explain it in detail, but it really shows sort of that progression of a hypothetical illness moving from a mainland to an island and then to a small community with it. And looks at it in the perspective of that percentage of the population that might be susceptible to the illness, the total threshold level that the illness would need in order to stay in that community constantly, and below that threshold, then it sort of recurs or comes back, depending on the introduction of it. And that's all about, they talked about disease thresholds and how small islands allow us to better understand those thresholds and so on. The second thing they looked at, and others have looked at, is this issue of accessibility, a broader topic that island studies researchers have looked at in many ways. But historically, this was very important. And I just put a couple of slides up here. If you look at the one down at the bottom here, of course, this represented a dramatic change in how illnesses, contagious illnesses are transmitted, and how accessibility would have affected the likelihood of the spread of some of these illnesses. So in 1957, there were about equal numbers of passengers that moved between Europe and North America. In 1 year, that had started to change dramatically, and by 1960, almost 2/3 were going by air and only 1/3 by sea. And of course, other than cruise ships now, almost everybody goes by air when they're allowed to go by air. The other thing that some of these early public health and island specialists looked at was the importance of islands because of the record keeping, and especially in sort of understanding index cases or the first person that they could trace back. And part of this was because prior to the age of air travel, extensive air travel, ship records were much more sort of detailed and precise. And so if epidemiologists wanted to do contact tracing and tracing back to the index cases, they could do it much more easily on a sort of an island environment because of the existence of meticulous records. And fourthly, I just wanted to put up this point about places of quarantine and islands as places of quarantine. I have this image of Australia here, and many people are familiar with the histories of Christmas Island, Manus Island, Papua New Guinea, and Nauru. as places of quarantine, as political quarantine, but they and many other islands of the world prior to them have had long histories of places of disease quarantine, of reserving a place for people that may have contracted or potentially contracted illnesses. And of course, one of the more famous historical examples are the islands in and around Venice. One of the things I think we need to understand about islands, and these are sort of generic kinds of comments, and they're not intended to apply to every island, is that we have to look at some of the underlying conditions that exist on a number of islands of the population. And some islands, especially those in Oceania, their populations can be more vulnerable because of the prevalence of some kinds of underlying preconditions. And for those of you who have studied public health in many of the islands of the Pacific or Oceania, you'll realize that obesity is a prevalent public health problem, and at least partly linked to obesity are the problems of diabetes, cardiovascular kinds of problems, and so on. And so those populations are therefore at greater risk for a variety of different kinds of especially of respiratory kinds of diseases. The other vulnerability is access to healthcare, access to therapeutics, and access to vaccines, equipment, and so on, and the relative poverty of some islands. But we shouldn't necessarily be that simplistic about it, because many islands, according to other kinds of indicators, may actually have a greater level of resilience to certain kinds of public health issues. So if you look at it from a social determinants of health perspective, and just take one indicator like the Human Development Index, that many of you are aware sort of uses a sort of a simple composite score looking at health, at education, and at the economy, often the HDI for islands are higher than the typical HDI for other small jurisdictions, and especially higher for other developing jurisdictions. And then if you dig down a little bit deeper and look at subnational island jurisdictions, that Prince Edward Island is and many other islands are, you see that the HDIs in subnational island jurisdictions are actually higher on average than they even are for small island developing states. So my last couple of slides, because I've only got about 7 minutes and I'm probably close to that end right now, I just wanted to raise a couple of cautionary notes as we go into the more specific topics in the next several speakers and the Q&A. One is this issue of islands as living labs, or the trope of islands of living labs. This is not a new thing. Islands have been used elegantly as considered a living laboratory. And I think there's something about this, an island that has a coastline and it's separated from the rest of the mainland or other islands, that make people think that they're closed or they're so-called pure systems. You see this in terms of the work by Darwin and others on the Galapagos, where they would study evolution. And even now we look at biodiversity and the closed systems on islands. You also see this in terms of some of the research that's taken place on islands that have emerged, volcanic islands that have emerged from proto-islands or submersive islands. And so they've emerged, such as Surtsey off the coast of Iceland, and scientists have looked at how life emerges there, how it is blown onto that line, or how it emerges, and how it evolves once it does emerge. And then, of course, there's a long tradition of colonial anthropologists who have studied social life in small islands, and although they themselves may not have implied that these are closed systems, others have looked at that and looked at social customs and characteristics and cultures and thought of them as partly as a function of the closed system in those islands. And just maybe the item in yellow I've got here is, we're all aware that in fact no place is completely closed or completely pure. And in fact, there is a case to be made that many islands have very high levels of connectivity, for many things else. So just the cautionary note is, be careful about the assumptions we make about using islands as living laboratories. The second and last cautionary note I'll bring, and that is this distinction between the unique and the generalizable or the distinct. This is not unique to island studies, of course. It's a dilemma and an issue that exists in any kind of field or discipline. But in terms of island studies, there has often been a debate about the ways that islands differ from each other and the ways that they differ from mainlands. And in fact, are they unique in certain ways that allow us to think of them as the geography of them and the social psychology of them as geographic context in and of themselves. And the other point about this is, if they are unique, then how do we deal with issues of transferability of both the challenges and the solutions? So if one of the things we're talking about today is reopening and the successes that some islands have had in terms of reopening, then how transferable is that solution or success either to other islands or to mainland regions? And as I say, this is not unique, but I think we need to keep these in mind. Whether the COVID-19 challenges, success, and reopening experiences are or not relevant to other jurisdictions, and what are the unique features of each island that are going to make the outcomes differ on those other contexts. So I'm going to stop right now and stop share and turn it back to Laurie.
Thank you, Jim, for those mind-opening comments. It reminds me of those two great thinkers, John Donne, No Man is an Island, and the other one, Simon and Garfunkel, I am a rock, I am an island. And so where are we? Somewhere in the middle, I suppose. Thanks, Jim. Our next speaker is Dr. Francesco Sindico, who's the co-director of the Strathclyde Centre for Environmental Law and Governance, or as you've heard me say, SCELG, when I can't quite get all the syllables together. He's based at the University of Strathclyde in Glasgow, Scotland, and which is one of the leading centres in the UK in the field of environmental law. And we had the great privilege of getting to know Francesco over the past several months, as he is one of the pioneers in, he and James Ellsmoor spearheaded the huge database collection of data from islands around the world on responses to COVID-19. So I'll turn it now over to Francesco.
Thank you very much, Laurie. As you said, I am the founder and co-director of the Strathclyde Centre for Environmental Law and Governance, and it's an absolute pleasure to be here today and share these first part of the session with Jim. So I'll start immediately with the slides. I will share them in just a second. So share screen. Okay. So just 1 second. Okay, there we are. So what I want to do in the next 7 minutes, and I start the clock now, is to look at how we can move from a global pandemic to a more sustainable and resilient future. I will anticipate I do not have the answers, obviously, but I do want to start a conversation, which I hope, especially in the Q&A, we can take forward. And as Laura said, together with James and Island Innovation, SCELG has carried out this survey, and I will say a little bit about it, but at the end of my presentation, I will put in the chat links and a bit more information about it, so you can have a look at it yourselves. I want to do 3 things in the next few minutes. First, I want to tell you a little bit more about the survey. I want to highlight the policy recommendations that it has led to. And then I want to move forward. I want to tell you a little bit about a further project that we're doing with the Institute of Island Studies at UPI and Island Innovation on sustainability and resilience, which is really about, let's take stock of where we are now and try to go forward. So when it comes to the survey started with an idea of gathering practices in the first phase of COVID, when it was really starting, when countries and islands were locking down. And we started it on the 22nd of March. It finished on the 1st of June 2020. And thanks to Island Innovation and our network, we really were able to reach out globally. We were very, very happy with the result. We got 130 respondents, but a lot of them were multiple because they provide us updates and really excellent insight. And we ended up having input from 83 islands from 54 countries. So really a truly global representative. We did it in order to share practices to policymakers and wider stakeholders on islands. And I'm really delighted to know that in some cases, these insights were shared to policymakers. They did reach out to those who were taking very difficult decisions, and it helped shape a little bit their thinking and their policies. So what were the final recommendations that we came up to, Island Innovation and SCELG, by analyzing all this information? So the first one is that, except some unfortunate circumstances and examples such as Sarim in Estonia or some islands in Venezuela, overall at the time, islands fared quite well. The island geography helped. So you can think of very remote islands like Tristan da Cunha or St. Helena that James mentioned, or Fernando de Noronha in Brazil. They really cut themselves out from the world in terms of transport. This also happened in Scotland with most of the Scottish Isles, especially the Western Isles, and that kept them at bay, safe to some extent. But it's not only that. It was also this timely and stringent measures adopted throughout the lockdown period that, to be honest, most islands around the world really took that timeliness. That was really, really paramount. Now, what has happened throughout the pandemic, and this I believe does not apply only to us, it has revealed something. It has revealed some aspects of the island socioeconomy that actually, until very recently, were considered very strong. Think of tourism in many areas, that almost from one day to the other became very fragile. And clearly, all around the world, we have seen such things as tourism, food security, health, and digital infrastructure, amongst others, that really were highlighted in the survey as we need some rethinking. And this is very much where our work wants to go, to use the COVID-19, as unfortunate as it has been, and it is, as an opportunity as well. But in order to go somewhere, there needs to be a conversation, although I will highlight what I mean by that. So what came out from the survey is that there needs to be an open and transparent debate to drive these post-COVID-19 recovery packages. This is very important, especially, and if you see the pictures there, when you have, in a way, two sectors of the island that could seem to be antagonists, but actually should talk together. In the poll that Laurie launched, it was interesting to see that the first one was economic recovery, 70%, and environment and sustainability, 59%. The two should not be either or. One of the possible successes going towards in the future in a post-COVID-19 recovery package is, how do we do a recovery package that, yes, promotes economic recovery, but at the same time also promotes environmental conversation. The Cayman Islands, for example, tourism is a big issue. A lot of cruises and so forth, but there's a debate whether to have more cruises where in an area of the islands where there's coral reefs and they could hinder that, or have some sort of governance structure, investment business that can promote the two. Now, this is not an easy conversation to have, clearly, but it has to take into account further complexities. One is what already Jim mentioned, the nature of island jurisdiction. So some are island states, others are subnational island jurisdictions. some of the examples that will be mentioned later by my colleagues, for example, Julia and Andrew, Egadi Island and Shetland Islands, highlight this complexity, this political, legal, even constitutional landscape complexity. Then we have something that, although all islands obviously in a way are different because they're all around the world, there is something called the Sustainable Development Goals, which all countries of the world have agreed to. And there is the possibility to localize the SDGs in a way to promote a different kind of more resilient and more sustainable future. And then we need to do all of this in a way that aligns with the goals of the Paris Agreement. Because although COVID-19 today still seems like a huge problem and a massive challenge, let's not forget about the other challenges. Eradication of poverty, climate change, for example. One way to build this conversation is by realizing just what we're doing now, that we can have this conversation not only around the table, but also digitally. But at the same time, we also don't have to lose track of traditional knowledges and the traditional approaches to bring together island communities. So these were the conclusions from the report. Again, I will share the link in the chat in just a second. But what are we going to do now? What is SCELG and the Institute of Island Studies together with Island Innovation going to do now? Well, we want to move forward. It's not just about managing the crisis now, it's actually about considering the future and going ahead. And what we're looking for is ways, policy relevant ways to move towards a more sustainable and more resilient future. We have identified 24 islands. Some are island states, some are subnational island jurisdictions. The ones highlighted are the ones that we will have some snippets, some initial insights from our forthcoming speakers. But we will not just look at these islands and get a sense of how they performed in COVID and where they're moving in towards sustainability and resilience. But by analyzing these 24 islands, we will then work together, Island Innovation, UPI, SCELG, and any other partner who wants to engage with us in bringing together some briefs, some thematic briefs that could be health, tourism, food security, digital connectivity, blue economy, but there could be more, and present them and have a conversation with the policymakers and wider island stakeholders in these islands to really put forward examples and practices also from other islands that could be used as inspiration to drive a different kind of future. It's an ambitious project. It's a project that has in a way already started. We are collecting some of these pieces and we very much look forward to presenting them both to you here in the audience and to a wider audience. Laurie, thank you very much.
Great. Thank you, Francesco. We've had our first question, which I'll ask right now because it's so pertinent to what you were just talking about. Natalie Dietrich-Jones was asking when the survey was actually conducted and will we be doing a follow-up? Because some islands, of course, have seen increases since relaxing border regulations and previously imported cases have moved to community spread.
I think I'm still on. Yes, so it's definitely on the table. I remember talking with James, and at some point around mid-May, we said, okay, well, now we actually have to have some time to digest all of this information. 84 islands, 53 countries. It was great, but it was almost too much at some point. So we needed some time to actually look at it and think it through. But it is very likely that, again, joining forces with Island Innovation and potentially also with other partners, we come up with a revised set of questions or again, a second set of questions. Julia will know very well. We have seen in Italy, islands, even big islands like Sardinia that seemed completely beyond the reach of COVID. And the moment they were opened, they are now the hotspots of COVID in Italy. So clearly there are challenges and it may well be that we reopen. Thank you very much.
Great, thanks, Francesco. And we'll look forward to hearing more developments as we go forward. Again, the beauty of the connectivity that we're all enjoying is that we can get things out there quickly now. Those linkages have been made and connections made to bind us all together in that wonderful way. Thanks, Natalie, again, for that great question. The next part of our discussion then is featuring some of those individual islands responses and examples of resilience and how people have responded. So first up, we have Dr. Julia Sayeva, who is the Marie Skłodowska-Curie. Marie Curie, I know that name, but not the middle part. She's the individual fellowship holder with Strathclyde Centre for Environmental Law and Governance. So Julia, I'll ask you now to bring up your video and tell us a little bit about your island of Agadi.
Good morning, good afternoon, and good evening, depending on where you are at the moment in the world. Thank you, Laurie, for introducing me. As you said, I am part of the Strathclyde Centre for Environmental Law and Governance, just like Francesco Sindico. And I am actually I come from Sicily, which is a big island in the Mediterranean Sea. And I have worked so far on indigenous people's rights, and I am focusing at the moment on the idea of rights for ecosystem services. And in particular, I'm looking at the Agadi Island, that, as you can see from the map, are an archipelago based in the as an archipelago in the Mediterranean Sea, composed of 3 islands, Marettimo, Favignana, and Levanzo, where about 4,000 people live at the moment. And I do take advantage of the fact that my hometown is very close to that. It's Palermo. It's not far away from the Agadi. The Agadi are a municipality, so they have a basic level of independence, but they are a part of the Sicilian territory, and they are about 34 kilometers square of islands. They are located within the Agadi Marine Protected Area, which is the biggest marine protected area in the, sorry, I have to, the screen sharing was not working. Well, I thought it was. Okay, so, okay, so as you can see now where the Agadis are, where the red tuna fish is, close to Sicily, and this is how they usually look. So they are, as I was saying, located in the Agadi Marine Protected Area, which is the biggest marine protected area in the Mediterranean Sea, and they are basically have a double insularity, which is what has so far shaded them almost fully from COVID-19 cases, as no one was reported there. The lockdown was in fact very strict there, as in the rest of Italy, and it was really helpful to highlight at the same time their dependence and independence from mainland. In fact, the population coped really well with the isolation because they are actually used to it, because they are very solitary during winter month. But the lockdown also highlighted their dependence on food, water, and other goods coming from mainland, and from another important good, which is tourists. In fact, the Agadi rely on summer tourist activities as their main economic income. In fact, on the 22nd of May, which is shortly after the end of lockdown in Italy, they joined the National Association of Small Island Mayors to issue a manifesto actually calling against the abandonment of Sicilian islands by the Italian government. They claimed that they were in need of a very flexible and locally based approach to COVID-19 rules, because those that were imposed were not sufficiently adapted to small islands. And they were, of course, calling for more health facilities. However, as the holiday season actually began, all attention shifted toward it. At the beginning, they were scared that no one would come, but actually in July and August, they had a drastic increase in tourism, so drastic that the new restriction had to be imposed in the island. So for example, certain beaches were closed in the evening to avoid parties there, and the masks were required to be worn in the streets of Favignana's main city center, which is very small, but it was very, very crowded. as the fear for losing the touristic revenues decreased, the fear for COVID-19 actually came back again. The inhabitants were afraid to become a hotspot, a COVID hotspot, just like Sardinia actually did, because they know that on the whole archipelago, there only are 3 medical watches, which are basically small structures that only give first aid support. And any other thing has to be moved to the mainland, including COVID-19 tests. They ran a few tests, but they had to take the samples in the island and then move them to the mainland in order to have results. So even though during the last week of lockdown, there was a lot of saying about turning Agadir tourism in a more sustainable ways, lowering numbers, incorporating local knowledge and skills, the reality is that the wave of tourism was simply waved according to usual habits. Moreover, that is to be acknowledged, the Agadir's plans had to be probably all Agadir's plans for sustainability or anything else were actually halted by the fact that the mayor and a few other public servants close to him were arrested shortly after lockdown for corruption and for favoring friends and relatives. So that actually left quite of a lack of leadership in the island. The only real leaders at the moment for sustainability and sustainable development there are the administrators of the Agadir Marine Protected Area, which, as I said, incorporates the whole archipelago. They are working on many environmental projects concerning environmental education, valorization, research and monitoring, communication, patrolling, but they were doing all this project right before COVID-19 as well. So what really happened is that the COVID-19 kind of gave them more issues and halted a bit what they were doing. But it was not a way of saying, okay, let's change things, because they're already struggling with the local realities as it was before COVID-19. So what really happened is that the Agadir showed what lockdown can do in an island, but also what can happen when it is lifted and tourism reaches it as well. The important thing though for them was that they were really lucky. So they did not, so far they have not had cases, but similar path could have actually led to very opposite results. So thank you.
That's fantastic. Thank you so much, Julia. And we've already had a question about tourism, but I'll leave it until the end because I think that all of us on the call will have something to say about tourism, just as you have, Julia. Next up, we have Dr. John Telsford. John is the Associate Dean of the School of Continuing Education at the T.A. Mary Show Community College in St. George, Grenada. And John is one of our Institute of Island Studies Research Associates, and really glad to have you part of the conversation, John.
Good morning, good afternoon, good evening, and thanks, Laurie, and Francesco, for having me being a part of this interesting COVID-19 recovery plans for islands. It is really a pleasure to share with you from Grenada what has transpired thus far here in Grenada. As Laurie indicated, I am Associate Dean and lecturer at the TAMCC T.A. Mary Show Community College in Grenada. I'm also a research associate with the Institute of Island Studies at Prince Edward Island. My research focuses mainly on island sustainability through various lenses, including social metabolism, climate change, mitigation and adaptation, the Sustainable Development Goals, governance and policy, now looking at issues of COVID-19. So in Grenada, we had our first case of COVID-19 on the 22nd of March, and immediately the borders were closed. Legal instruments were put in place to effect restrictions on movement between parishes and restrictions of movements of persons. Many all schools, churches, social gatherings were halted, and tourism, which is one of the mainstay of our economy, was on a drastic decline and almost collapse. To date, there were only 24 confirmed cases. We have no active cases to date. Thank God there were no fatalities. And the borders through the international airport is open, but cautiously, using a risk assessment method based on where your country is located and the caseload of these countries. So, for example, we are open fully to Caribbean islands with very low caseloads and high risk. We're basically close to the USA at this point in time, which is considered to be high risk. As I indicated, as the lockdown tightened, persons definitely lost their jobs. The tourism sector was shut tight. And as Grenada is considered to be what Dr. Atz at the University of the West Indies refers to, one egg, one basket type of economy, where tourism is the egg. In that one basket economy, when the egg broke, the pressure began to rise. And what we saw as an effect of that was persons losing their jobs, high unemployment began to rise. And that put an economic squeeze on the government, which had to put in measures to cushion the effects of this economic squeeze. So what has happened, the government is reporting now that the revenues projected for 2020 has decreased by about 40 to 50%. Another important aspect here, what I refer to as educational tourism, is that Grenada has a very large offshore university, the St. George's University, which is a medical school. And this education service contributes about 20% of the GDP of Grenada on an annual basis. And with the closure of St. George's University, we saw that all this impacted on the actual GDP growth projected by the government for the 2020 period. So COVID-19 did have a very strong impact on the economy, but even more so on the health facilities. Thank God we did not have many cases, so we did not have to test the full metal of the public health facilities. So, but we know that our health facilities are quite fragile, and a lot of funds would have been directed into also trying to bolster the public health system to combat the COVID-19 impacts. So what is happening now is that we're still under the legal requirements to practice social distancing, to wear masks. Schools will be reopening on the 7th of September, but with very limited attendance and a strong blended approach to assist with the delivery of the teaching learning process. We also saw that during the COVID-19, when we shut our schools, it did show up some of the issues that we had with local connectivity, as many schools had to offer their programs online, and many students were having issues with accessing their classes online due to issues with the connectivity within the island. Going forward, the government of Grenada has implemented 7-prong approach to recovery, and it's looking at it in the context of tourism and what the Citizen by Investment program, construction, education services. As I indicated, St. George's University was a key contributor to GDP. Small businesses, macro, small and medium enterprise, agricultural and fisheries, wholesale and retail trade, and e-commerce and digitization. And these committees are putting what the government refers to as recovery plans in place. Unfortunately, as stakeholders, we have not seen yet the output of these plans, but I know that they're being tabled at cabinet, and hopefully we would have, as Grenadians, have an opportunity to see them and to maybe comment on them later. Another key issue that that I can speak to is how we look at the COVID-19 recovery in the context of the Sustainable Development Goals. And Grenada is localizing the Sustainable Development Goals through its National Sustainable Development Plan 2020 to 2035. And in there, I was part of the technical working group that worked on issues of that plan. And we did revisit the plan to see where we need to adjust and to accommodate issues of the COVID-19 and pandemics in general going into the future. And just to give you an idea of where we targeted the whole issue of pandemics and the likes, the plan has an overarching goal of high human and social development, putting people at the center of sustainable development and transformation. And one of the key outcomes there is a healthy population. We think that we need a healthy population to get to that goal. And that this goal and all the other goals within the plan, there are 3 overarching goals, but all the other goals are implemented through what we call medium-term action plans. And we adjusted our medium-term action plan in the context of COVID to look at strengthening the public health system, to look at remedying the issues of connectivity, because we are knowing moving forward, connectivity will be very critical for delivering our educational services, and also strengthening social protection nets and psychosocial support for persons who would have been socially and mentally impacted by the COVID-19 lockdowns. And all these feed up into the Sustainable Development Goal of ensuring healthy lifestyles and to promote well-being for all and at all ages. So I'll stop here and would be happy to entertain any questions or comments on what is happening in Grenada. Thanks again, Laurie and colleagues.
Great. Thank you, John. Really appreciate it. And I'm sure that there will be some questions because you've hinted at some of those policy things that are coming your way. And I think we would love to hear more about them. Next up, we have Dr. Andrew Jennings. And Andrew's a good friend from Shetland. And he is with the Institute of Northern Studies and the University of Highlands and Islands at Lerwick, Shetland. Welcome, Andrew.
Thanks, Laurie. It's great to be here. Yes, so as Laurie said, I'm with the Institute for Northern Studies, and I'm the program leader on the MLIT, the Island Studies. And I think that there are a few students from that listening today, and possibly a few graduates as well. And I'm very pleased to tell you a little bit of overview of how Shetland has coped with COVID-19, and to see if there are any potential lessons for shaping policy. So I'll attempt to keep this under 3 minutes. So I suppose the general situation is that it could be summed up as a big impact, but not totally devastating yet. So COVID-19 hit Shetland early with 7 deaths by May the 6th. 60% of them were in care homes. Thankfully, there haven't been any more deaths since. 56 people have been tested positive altogether, which is a high per capita number, including 1 new case in August. So it hasn't gone yet. and Shetland closed its schools a week before the rest of Scotland, claiming operational reasons, i.e. not enough staff, they said. But I wonder if it was a canny local move. Schools have recently reopened. So I'd like to look at the impact on the economy. Firstly, let's look at tourism. This is an important industry for Shetland, but small in per capita terms compared with other islands. The pandemic lockdown meant that the boats and aircraft to the mainland were reduced to almost nothing, and they were only for islanders with essential needs. And as you can imagine, this had a dramatic impact on hotel accommodation providers, which were already under stress for other reasons. Tourism was opened up in July, but because of social distancing, capacity on the boats and aircraft is still restricted, and inter-island ferries still need to be booked. So if you come to Shetland and you want to go to Unst, you have to book ahead. This continues to impact on outer islands where tourism is a bigger part of the economy. Interestingly, however, the self-catering industry has shown some resilience, with local visitors taking up some of the slack, having weekend breaks in different parts of the islands. However, the businesses that have recently been built up to cater for the cruise ship industry have been devastated because they've had no custom. There have been no cruise ships, and 105 ships and 90,000 visitors had been expected this year. If we turn to retail, local food providers have actually been very busy. Supply lines with the mainland were maintained, although there was some wholesale difficulty initially and some staffing problems. However, postal and courier deliveries have never been busier. And in May, Lerwick topped the list of UK postal delivery hotspots. Local essential shops throughout the islands have flourished because of home deliveries, which they continue. And the value of local retail services has been acknowledged and is much appreciated by the community. Moving to fishing, Shetland's fishing industry, which is worth about 1/3 of the whole of the Shetland economy, took a serious early hit, which, such a large amount is, as you can imagine. International markets for farmed Atlantic salmon, mussels and shellfish disappeared overnight. However, the Scottish Government provided financial support, offering £5 million in March to Scotland's inshore fishermen, which included those on Shetland, and a further £2 million equivalent in June. Recent data for salmon exports shows a fall of 33% for Scotland as a whole in the first 6 months of 2020, and Shetland makes up a large proportion of the Scottish total. However, once markets reopened in France and in Italy, exports have rebounded. Similarly, although whitefish landing continued during the heart of the outbreak, in May, landings were down by 40%. Again, the opening up of markets in France and Italy has helped that, and by June, catches were almost up to last year's average. It's important to realise that as part of Scotland and the UK job retention scheme, known as furloughing, also applies in Shetland. And at 25% uptake, this is one of the lowest in the UK. The Scottish average is 32%. However, £2.5 million has been claimed and brought into the Shetland economy, which is 3,100 claimants receiving money from the scheme. There's also been a doubling in the claimant count for job seekers and universal credit from May to July, which indicates unemployment in the islands. However, this is from a low level, so going from 3.7% to 6.5%. And this perhaps gives a false impression of economic health, because if you lose your job in Shetland, you leave and go to the mainland. However, it's still a big leap for Shetland, which has had historically very low levels of unemployment. 600 locals also got grants from the Self-Employment Support Scheme, and that's an uptake of 69%, the second lowest in Scotland. It should also be noted that the public sector is large in Shetland, so many jobs were protected and home working hugely increased. For example, I haven't been into the college now for, I don't know, 6 months, I think it is. Interestingly, in the housing market, there's been no fall in prices. House surveyors are reputedly very busy, and the online site Rightmove, which people look at to see, get their house porn, as it were, to find out where an interesting place might be to stay, have shown a huge amount of interest in people looking at houses in Shetland. A large number of large industrial projects have been delayed. Viking Energy at 370 megawatt capacity, one of the biggest onshore wind farms. The interconnect project to link Shetland to the mainland were both delayed, but work has restarted. Oil rig decommissioning has also restarted, and last week the world's largest ship arrived to deposit an oil rig for decommissioning. So what's the outlook like? Well, 2021 could be a difficult year as the job retention scheme comes to an end. However, Shetland is in some ways a self-contained area that has its own economy based on being an offshore platform of Scottish industry, with a large proportion of Scotland's fishing, aquaculture and oil and gas industries. And these will continue, but they are dependent on foreign markets. It has a more diverse economic portfolio than many other small islands, and there are also some large industrial projects happening now, which I've mentioned, or in the pipeline. So Viking Energy, the interconnector, decommissioning of rigs, a thing called the Shetland Energy Hub, which might produce 5% of the UK's low carbon energy by 2050, the development in Lerwick of one of the island's biggest urban development schemes, and a spaceport on Unst are all either, they've either started or will be starting at some point soon. Those should maintain the Shetland economy into the future. However, there's a potentially bigger cloud on the horizon than COVID-19, and that's Brexit. A no-deal scenario could be a real problem for an export economy like Shetland's. And just as a PS, there's been an interesting development within Shetland Council. Yesterday, they held a meeting to discuss Shetland autonomy, and I have a feeling this could be a result of the COVID situation. So there we go, that's Shetland, and you can tell me whether there's anything of relevance there to islands more generally.
Oh my goodness, I think so, Andrew. I really look forward to having this all down in front of me so that I can, pull it apart. And I think that other people will too, because there's a lot of meat in what you just said, and really appreciate it. And wow, talk about a perfect storm with COVID and Brexit, and maybe now Shetland autonomy. Woohoo! All right, talk about island studies. Andrew is a featured guest speaker in my class. You can tell us, you can see why. Thanks, Andrew. Okay, last but not least, we are going to come back to Prince Edward Island, where we have Jane Ledwell standing by. Jane is also a good friend of mine, probably my longest time friend that on this panel here. I've known her since she was just a girl and I was a young girl. So Jane is a researcher, policy analyst, and executive director of the PEI Advisory Council on the Status of Women. And outside of her full-time work, she is a writer, editor, and poet. Jane Ledwell.
Great. Can you hear me?
Yes, we can.
Great. Great. So I'm going to quickly share a screen here that shows what Prince Edward Island looks like. And for those of you who are not here today, I've shared both summer and winter. So that's what we look like here. As Laurie said, I'm currently the executive director of the PEI Advisory Council on the Status of Women. I have also in the past been a denizen of the Institute of Island Studies at UPEI, and so it's an honor to be here today. But my current work with the Advisory Council on the Status of Women is to work with a group that has a mandate to advise the PEI government and educate the public on issues that affect the status of Prince Edward Island women. And so my focus today will really be not so much on the details of recovery plans, but to make the case for putting gender equality considerations at the center of recovery plans here in Prince Edward Island and elsewhere. Because we have seen that COVID-19 and the challenges it creates have certainly been an issue that affects gender equality, and that the circulation of disease and the pandemic responses, including public health measures, have affected different genders differently and unequally. So our capacity in Prince Edward Island as a small island jurisdiction to impose manageable border controls has resulted in a very low infection rate. but it has also shut down tourism and other industries, hospitality sectors that are familiar in other islands as well, and that employ an awful lot of island women. Not to mention the effects that those shutdowns have had on women-dominated social service sectors, the closure of schools and childcare facilities, limitations on visiting of long-term care homes for those who are ill or who are elderly. So in PEI, women's unemployment rates have outpaced men's unemployment rates since the beginning of the pandemic by margins that are incredible and that are unseen in any other parts of Canada. So as part of my work, I've been helping to capture some first-person stories of women connected to our council and their experiences through this pandemic time. And a primary theme is that women, especially women with caregiving responsibilities, are bearing the brunt of lockdown measures as a result of COVID-19. And that has not only economic effects, but also social and emotional effects, and ultimately cultural effects. COVID-19 has laid bare some of the gender inequalities along with other inequalities such as racial inequalities or poverty and economic inequalities that are significant societal vulnerabilities for our small island. And if families, communities, and institutions in Prince Edward Island are going to recover well, we're going to recover well to the extent that we support the resilience of caregivers. And in fact, there will be no economic recovery without supports for caregiving, and especially childcare. So we need to transform our understandings of labor and the value of unpaid labor that keeps the individuals, families, communities, and societies resilient in this part of the world and around the world. So to achieve that, women and gender minorities need to be central as participants in the recovery plans in order not only to ensure that they are part of decision-making, but to ensure they are more equal beneficiaries of recovery plans. Because we know in every context that's been studied around the world, more diversity in decision-making and more gender diversity around decision-making tables results in decisions that are more durable, more sustainable, and that work better for more people. So as a small island jurisdiction, I think another consideration is that coordinating solutions for gender sensitive and gender responsive recovery plans needs to be integrated really closely with our climate change adaptation plans, and that's really essential as an element. Since I have very little time, I'll just end with one reflection, and that's that to reflect that we must not forget on a small island where those border controls can be so effective in quarantining us from disease. It creates not only economic effects, but also social and cultural effects, including an epidemic that we hear from the women in our circles of loneliness due to the quarantining that isolates us from not only from disease, but from beloved family members, beloved support systems, beloved islanders who now live away and cannot return. And it really reveals islands' global interdependence and islands' true interconnectedness with global systems. And that these are all things that we have to hold in our hearts and hold in our minds as we decide on policy directions for recovery from an island place in the world.
Thank you, Jane, so much for bringing that into the conversation, because that is definitely what we are seeing here on Prince Edward Island. And I love the way you make the connection between the local and the global, which is exactly what we're trying to do here today. So that's the end of our formal presentations. And this is the time where I would love to ask the audience for any questions or comments that they would like to make. We've had one question come in, and I'll just read it. This was just after Francesco was speaking, and it's kind of been dealt with or addressed, not really dealt with, but addressed. And while I'm talking, how about all of our panelists, please come back on screen with your pictures. That'd be great to see everybody. That would be wonderful. The question is, despite having challenges for the recurrence of COVID, quite a few island states have to open their frontiers since their economy is mainly based on tourism. So are there any policies in place specifically for tourism? Now, I've been on a few calls and Zoom calls and webinars over the past several months that talk about tourism. And I know that specifically, or particularly in the Caribbean, that you guys have been dealing with it here in Prince Edward Island. We have all over the world, since tourism is such a huge issue for and economic generator for so many islands. I think that it's top of mind for many people. So just curious if any of our panelists would like to jump in for maybe a couple of comments about tourism. And then equally so is what Francesco had put in the chat about policy and having boots on the ground doing stuff about it. We can't just talk in and check about what's going on. We need some actual solutions, or at least best practices that might be adapted and adopted by islands. So John, you have your microphone off. Did you want to say something?
Actually, no, that was not the intent, but maybe since I'm here, I can actually make maybe a comment or two on the whole issue of tourism. As I mentioned very briefly in my presentation, one of the committees that was established by the government of Grenada actually focuses on tourism and the Citizen by Investment program. My only worry about the thrust that I'm seeing is that it is not bringing anything new per se. It still seems to be focused on what is the thrust of mass tourism. It simply went back to 3 projects of resort tourism construction outside of the main tourism belt in the north of the island and in the south eastern corridor of the island. And it did bring some pushback from stakeholders because these tourism developments are actually happening in very ecologically sensitive areas. So I am not seeing from my government per se innovative approach to dealing with tourism, what I would refer to, or what other commentators would refer to as high value tourism, looking at the key niches in ecotourism and other aspects of the features of the island that can be used for future tourism development that can be more nimble and be more flexible to the shocks that we experience on islands, the external shocks like pandemics that we do experience from islands. So that's where I would end my comments.
Great, thank you, John. Orsa Beck, one of our master students from Sweden, has mentioned that one of the things that they did right away was to quickly relocate employees from tourism to the health sector, which eased the economic and health pressure. So that was an interesting move. Jim, you put your hand up.
Sure, thanks, Laurie. And I'm clear, I'm not a tourism specialist either, but I will say, and those that are part of the group, the participants here will perhaps understand this better than I am, but from an Atlantic Canada or Eastern Canada perspective, there are 2 very broad policies that our Atlantic province has put in place in order to, I'm sure at least partly, if not mainly, a function of the tourist economy. And that is, first of all, to create a bubble that allowed for the relatively free movement of people who are already resident within any of the 4 Atlantic provinces. And that was not without controversy. But then the next step, at least from a Prince Edward Island perspective, was to allow seasonal residents. In other words, those who have summer homes that are located elsewhere in Canada to come back and stay here as long as they self-isolate for the first 2 weeks. And once again, that was a policy that was quite controversial at the time, but it was an attempt to try to recover at least some of the tourism dollars. And it would just be a modest percentage of the total tourism revenue that's generated, but some of them. And I agree with John. I don't think there's really been, at least in a transparent way, there may be a lot of thinking going on behind the scenes, but transparently, there's not been a lot of thought about how a reopening could shape tourism to be much greener or allow the province to be more resilient. I'll stop there.
Great, thank you. Thank you, Jim. We have a question in the comment changing the subject from tourism to education. This is from Carla DeGiorgio, who I know is here on Prince Edward Island. What role do you see for universities, colleges, and schools as reflectors and leaders for support and policy for learners and cultures? Do you see islands as being potentially closer and more able to address this in their communities? And I know we have a few educators here on the line, so I'm wondering if anybody would like to address that. I know that we here at the Institute of Island Studies, through our Master of Arts in Island Studies program, have been working with our students to address many of these issues. And as Jim mentioned in his overview, talking about what the key role that islands can play in educating, and you know, do we have lessons that can be passed on to other people? So I just throw that out there. This was what role do you see for universities, colleges, and schools as reflectors and leaders for support and policy for learners and cultures? Andrew, did you have anything that you'd like to add, being the director of the MLIT and Island Studies at UHI?
Well, it's a very good question, isn't it? It's one of these ones that you want to ponder. Well, yes, they definitely do. I've just recently been asked in this debate about Shetland autonomy. Well, my name was put forward if they want more detailed information about how other island autonomies work. They can always approach a said expert at the Shetland College, i.e. myself. So I think we have a very important role as disseminators of knowledge, and because of the networks that we've already established between UHI, UPEI, Malta, and other places, we can answer many of the questions I think that policymakers in islands might need answered. I think we have a central role, but whether the policymakers know that we're here, that's another thing. We need to be seen, and so that we can disperse our wisdom.
Yeah, I agree about that. Being we serve here as a bridge between the university and the community, and help to contribute to public policy making on Prince Edward Island through the Institute of Island Studies, and that is a very big role. And some of the information and theses and reports and stuff that our students come up with certainly feed into the public policy arena. I know that Shelley Jessup is somewhere here on our call, and Shelley is working with the Rural PEI Business Women's Research Center. And I'm wondering, Shelley, if you wanted to just come up and say a couple of words about how rural business women are dealing with COVID-19, and are there any examples of, you know, really great things that people are doing?
Great. Can you hear me?
Yes, we can.
Hello. Hello. Nice to meet you, Laurie. Thank you very much. Enjoying the session here today. My name is Shelley Jessup. I'm the manager of the Rural Women's Business Center in Central Badek. We are part of the PEI Business Women's Association, a member-based organization that supports women in business throughout PEI. Our center out in Central Badek was just opened last November, and extends the services that PEBWA offers to reach more women in rural areas. As Jane had mentioned, gender equity is on top of mind. During the pandemic, what we've seen are both the struggles and resilience of the local business community as a whole, but particularly women. The women that we serve, oftentimes primary caregivers of children and family, essential workers. Women have had to adapt and balance work and home life on a different level. And the creativity, strength, and perseverance that we have seen in women is inspiring, brings hope in these challenging times. I feel that being heard is critical, and creating forums for women to connect, express challenges, and share experience is key. At PBOA, we are continually engaging with our membership and women in the community to hear their challenges, identify gaps, and determine how we can fill those gaps. We have flexible programming that is required during the pandemic, not only to persevere through the pandemic, but to adapt and to find a new way to thrive during these uncertain and changing times.
Well, that's great. Thank you so much, Shelley. And just following on about the rural part, I know Sarah Minnis had to go. She's the president of the Canadian Rural Revitalization Foundation, but she put a link in the chat to a series of rural insight papers that have been written by academics and policymakers from across the country dealing with various issues, sector issues with COVID-19. And so it's a very rich a library of actual, you know, I say that again, boots on the ground suggestions of policy making. So thank you very much, Shelley. We have about 5 minutes left, and then we have to pop off because the Island Innovation is a very popular Zoom license today with lots going on around the world. And so who knows where this call will be going to next. Anyway, we've had another couple of comments in the chat about tourism. And Margaret Patterson, one of our Mays students, writes, tourism was prior to COVID, tourism was quite an unfettered high-touch industry. Going forward, what ideas have been proposed to open tourism in different and socio-culturally new ways to preserve economies, but also health preservation? And this makes me think of something that the Faroes did, which of course was closed to tourism, but they opened up a whole whack of online experiences so that you could actually go and visit the Faroes without having to fly there and potentially bring COVID-19. Does anybody have, Francesco? Yeah, that would be great if you wanted to jump in here. Thanks.
Thank you very much, Laurie. I was going to write to Margaret, so I'll just say it here. I just had a very interesting conversation with colleagues and people in the Seychelles precisely about this. And I think what comes out from that conversation is that I think it would be very useful to move away from tourism per se is bad, or tourism is the only way forward. It's obviously a question about two things, about diversification. So any country, any island, if it only puts all eggs in one basket, be it tourism, be it aluminium industry, there is a risk. So that's the first thing. The second thing, and this obviously comes from the person in the Seychelles that I was speaking to, it also depends how the revenue from tourism is used. So according to this person in the Seychelles, actually, a lot of the tourism is not the super investment coming from overseas that only benefits the foreign direct investment and, I don't know, the Cooks of the world or the Virgin of the world. Actually, it did reverberate quite nicely into the local economy. So I do think, like many other sectors, when we think of tourism going forward, yes, we can talk about ecotourism, we can talk about virtual tourism, as you said in the Faroe, but it's about moving away from that. It's either nothing or everything. We really, and again, the most important thing in my opinion, although it's just setting up the platform, and then as I said in the chat, we need actions, is we need both players around the table. We need, let's say, and obviously John can confirm, but in the Caribbean and Grenada, we need the cruise line. You may like it or may dislike it, but you need that part of the business. And you need the environmental aspect, the sustainability aspect, and so forth. If you don't have both, it's a difficult conversation to have, clearly, but it's one that may take you forward. I'll stop there.
Great, thanks, Francesco. So I'm at 12:29. I think we're going to get, the lights are going to go out in about 1 minute. I just wanted to say again, thank you very much for joining us today. I believe, are recording this. We'll make the recording available online on our website, islandstudies.com. Just also wanted to add that this is a teaser event for the Virtual Island Summit, and next week on September 8th at 5 p.m. Atlantic Daylight, we will be here again presenting, some of us will be here again. Jim and John Telsford, for instance, are also on this entitled Towards Sustainable Island Futures, Comparing Small Island States and Subnational Island Jurisdictions. So we'll also be bringing in speakers from Newfoundland and Labrador and New Zealand, and someone else from the Caribbean. So again, thank you very much for being here and adding to this conversation, and I really hope that we can continue it. I know that the Virtual Island Summit, there's going to be lots of opportunity for this kind of interchange with global leaders and researchers, policymakers, and regular citizens from all around the world. So I hope you'll join in. And thanks again, and see you next week. Bye-bye.
Bye-bye.
Bye.